Hey friends, welcome back to Funeral Facts. My name is Victoria. I'm a licensed funeral director and embalmer, and I'm here to spit the facts to you about funeral service, both in modern times and throughout history. So today we are going to be discussing one of the biggest misconceptions that a lot of people have about embalming, and that is that it is the same thing as an autopsy. It is not. There is a huge difference between embalming and autopsies. So today I'm going to tell you the difference between the two of these things. And I'll go into an in-depth explanation of what exactly is embalming. So to start off, the two procedures are completely different. They're done for completely different reasons by completely different people. So an autopsy is mainly performed as an investigative procedure, whereas embalming is done as a strictly preservative and sanitary procedure. So an autopsy is, I don't know if I would call it a medical procedure, but it's done to determine the cause, mode, and manner of death with a person. And this can be done for a variety of different reasons. One of the biggest reasons is if it's done forensically, it's going to be done to figure out whether a death was caused by foul play. Sometimes in a clinical standpoint, it could be done to determine the cause of death for a death that occurred unexpectedly, or the person wasn't being seen under the care of a doctor, or some kind of reason like that. And it's usually done by an autopsy technician under the direction of the medical examiner or the pathologist. Now, disclaimer, I am in no shape or form any part of the medical examiner's office. I am not an autopsy technician. I am not any of that. This is just me speaking objectively from what I've seen being present during an autopsy and through embalming autopsy cases after the autopsy has been performed. So please do not think that I am speaking for all autopsy technicians or medical examiners or coroners or pathologists out there. I'm not. I'm strictly speaking from an objective point of view and the facts that I know about autopsies and why they're done. So if there are any viewers out there that are part of the medical examiner's office that have performed autopsies, anything else, and you want to weigh in, please do so. Please correct me if I get any of this wrong. Again, I'm an embalmer, I'm a funeral director, I'm not an autopsy tech. So now that we have that out of the way. So let's say that there is a person that is elderly and they are under the care of a nurse, hospice, nursing home, a doctor, anything like that, and they pass away. That would not warrant getting an autopsy because they're in the care of medical professionals already. They have all their records, they can determine the cause of death without doing an autopsy. But let's say that it is a perfectly healthy person that just dies. Randomly. No idea why. Was not seeing a doctor for any type of diagnosed medical condition, was not under the care of a hospital or anything like that, just dies. That would be cause for an autopsy to be performed because the cause of death is suspicious, it's not determinable by any kind of records. Then they would perform an autopsy. Or if a person is suspected to be a murder victim or something of that nature, homicide, manslaughter, an overdose, any type of suicide, that sort of thing, then they would do an autopsy to determine what the cause of death was, the manner of the death, whether it was homicide, suicide, natural, etc. And those are the instances when an autopsy would be performed versus when it wouldn't. So what do they do when they do an autopsy? The body is brought to the medical examiner's office usually, or coroner's office, depending on where you're from. And they are undressed. They are examined exteriorly to see if there is any sign of, let's say, gunshot residue, or if they can see stab marks, if they can see a bullet hole, if they can see something that would indicate what this might be. After the exterior examination is done, then they perform an interior examination. What they do normally, what I've seen at least, is they make an incision. It's called a Y incision. It starts from the shoulders, goes down to the sternum, and then all the way down in a straight line to the pubic bone. The skin is flayed back, exposing the internal organs. Then they cut out the sternum breastplate, this area here, so your ribs, your sternum, this part is cut off so that they can have access to the lungs, the heart, everything that's under there. Then they will start to remove organs. Sometimes they'll remove them in groups, sometimes they'll remove them in one large block. There's different names of them for them, but I'm not 100% familiar with it. Again, I'm not an autopsy tech, so I don't do this on a regular basis. I don't know the exact terminology, but there's terms for that. But what they'll do is they will examine all the organs. Sometimes they'll take samples of them. I've seen slice marks being made in the organs. But they're basically checking to see, was anything damaged, was anything ruptured, was anything perforated, what could this death have been caused by. So after that, they will do an autopsy of the cranium, the head. What they'll do there is they make an incision from ear to ear, peel the skin forward and back, and they will cut out a skull cap in the skull, take that off to expose the brain. They'll do the same thing with the brain. They'll take the brain out, they might take samples of it, they might cut it, they might just look at it, I don't know. But they will do that to determine if there was anything brain related that could have caused the death of this person. After they're done examining everything, there's usually never a reason to examine the legs or the arms. Sometimes if it's a suspected spinal cord injury, they might autopsy the back and just remove the spine. Very rarely does that happen, and very rarely would it happen that they would cut down an arm or a leg or something, unless, you know, their findings were inconclusive and they think there might be something there, but that's, you know, extensive. Usually that doesn't happen. But all the samples will be sent off. The organs are then placed usually in a, we call it a viscera bag. It's like a biohazard bag, basically. The bag is tied up and placed back inside of the abdominal cavity, and then everything is stitched up. They stitch up the abdomen, they stitch up the head. They do put the breastplate and the skull cap back in, stitch everything up, and then that person is sent to the funeral home. Now, once they're in our care, that's when our duties start. So all that stuff, that's done for investigative purposes. What we do for embalming is completely different. Regular embalming, we don't remove anything except blood. So it's a completely different procedure. Autopsies are very invasive. It's considered consensual mutilation of a body. The family will usually have to sign off on their approval for it. You can deny an autopsy if it's for religious or personal reasons. You can, you know, refuse to have one performed. You may not get an exact cause of death placed on the death certificate at that point, but you can refuse it. We've had people refuse it before. So that's that aspect. That's the autopsy. So embalming is done for two major reasons. First reason being sanitation. you want to sanitize the body, because as weird as it is to say, once a person has passed away, their body, it's not exactly considered to be sanitary. There's a lot of microorganisms that could be on the body or in the body that could affect a living person, that could cause harm, that could cause major issues with the body itself. If the person died of a communicable disease, that's a risk factor. You need to protect yourself from that. And you just want to, preserve the person's dignity, give them a good cleanup, make them look their best. So that's really the sanitation portion of it, to make the body sanitary, to be in the presence of the public. The other thing that we want to do with embalming is preservation. Preservation meaning when a body is embalmed, it's usually because the family would like to have a traditional sort of funeral service with an open casket viewing, with a funeral service or mass or what have you, whatever their religion may be, and then a burial or a cremation afterwards. So in order for that to be done, normally there's, a little bit of a wait time in between time of death and time of final disposition. So we want to have the body preserved, and we do that with embalming. Formaldehyde is the primary chemical that we do use in embalming fluids, and that is a chemical that will preserve and firm up the tissues. It's a whole, it's a chemical reaction with all the tissues in the body, preservative, all that good stuff. So that's the second most important thing that we want to accomplish with embalming. So in a standard embalming, and I say standard because not every embalming is going to be exactly the same. There are so many variables in embalming that could affect the outcome. It could affect the way that the body turns out. It could affect your embalming process. Never is anything ever textbook. So you always have to be looking at things. You have to be observing how everything is going. You need to adapt to what's happening. It could be time of death, from the time of death until we have the body in our care. That is a factor that could affect our embalming process. Also, what the person died from. There could be something that they had that could affect our process. Cancer could affect it. If they were on blood thinners, that affects our process. So many different things that could affect our ability to perform a good embalming. So that being said, I'm going to talk about a standard embalming. So basically what embalming textbook will tell you, this is what it should be. It usually never is like this, and on the off chance that it is, we jump for joy. But here is embalming explained as it should be. So the first thing that we do is we remove the clothing from the body. The body is always covered in areas to preserve the dignity of the person. They're not going to be, out in the open. That's not respectful. So we do cover them so that, everything is hidden. So they're undressed, and we examine the body exteriorly, similar to what an autopsy technician would do, but for a different purpose. So we're looking at color. We're looking at if they had any sort of medical devices attached to them. We're basically looking for anything that would give us an indication on what kind of embalming solution we're going to make, what kind of chemicals are we going to use, what are we going to do first, do we think that we need to do something special for this person that we wouldn't do for another person. So once that's all done, my process is then to wash the body down, give it a good wash, and set the features. What that entails is basically making the face and the facial features look peaceful, give them a nice peaceful expression. We close the eyes and we put eye caps underneath the eyelids, which are basically like a little rounded disc with ridges in it, and it helps to keep a more lifelike appearance to the eyes, because after death sometimes the eyeball will actually get a little sunken. So the eye cap also helps to, you know, give a nice shape to the eyelid. The cavities of the face are all cleaned out. I'll clean the eyes, I'll clean the nose, I'll clean the mouth, and then I will close the mouth. There's two different types of methods that you could use. You could use a needle injector, or you could suture the mouth closed. A needle injector is basically a little doodad that you would use to put basically a metal post with a wire on either side of the mandible. So one up top, one on the bottom, and then you would use the wires to tie together so that the mouth is closed. That doesn't really work on people that don't have teeth. So in that case, I would suture the mouth closed. So that is, you take a piece of ligature and you go through the nose, through the septum, down through the musculature here, and tie the mouth shut. It sounds barbaric, I know. It's really not. It's just our way of keeping the mouth from hanging open. We'll also sometimes fill out the mouth area just to make the person look their best, to make them look more in a natural state. We might fill out the mouth with either cotton or web roll, which is a type of cotton, but it's thinner. So, and the point of all of this is to give a very nice, natural, peaceful expression to the face, which can be very good for the family to see, rather than how they looked in their final moments, which could have been a very painful looking expression. So we try to make the person look as natural and as peaceful and almost like they're sleeping in a way. So after the features are set, I will wash the hair, give that a nice shampooing, and I will shave the person if necessary. I'll usually shave men and women depending on, you know, the state of their facial hair. And then after that's done, I will mix up my solution for embalming. So there's multiple different types of embalming chemicals. I might do a different video if you want about the different types of embalming chemicals that exist and what their functions are, what their purposes are, what's in them, things of that nature. It's way too detailed to go into in this video. This video is probably already going to be 1.5 million years long, so I'm not going to go into that right now. I'll save that for the future. But you mix up the tank. The embalming fluid is diluted with water. I'll usually do a full tank, which the one that I work with is a 2-gallon tank, so I'll mix up roughly about 2 gallons of water and fluid, get that all ready to go, and then your next step is to look for vessels to raise for injection and drainage. Generally speaking, most embalmers will use the right common carotid artery for injection and the jugular vein that accompanies it for drainage of the blood. So I'll make an incision right above the collarbone, locate those 2 vessels. It's called raising. So you raise the vessels. With the jugular vein, you make a little incision. You put either a drain tube, which I don't like to use very often because to me they don't make sense, especially if there's a lot of clotting happening. It doesn't make sense to use a drain tube. I'll usually use the angular forceps, which are kind of like big tweezers, but they're bent, so they kind of look like that, but longer. So you take the angular forceps and put those into the vein to open it up to allow for a nice opening for the blood to drain out of. Next, you take your common carotid artery, you make a small incision in that, and the cannula, or the tube where the formaldehyde comes out of to inject, is placed into the artery and clamped off with a pair of hemostats. And then you're ready to start injecting. So you turn your machine on. Most machines will have what's called a pulse function, so it mimics a heartbeat, and that helps to kind of break up any blockages or clots that might be in the arterial system, get that out of there, and then eventually we just put it on continuous flow and it just goes. So while injecting, we want to massage the person. You want to massage the arms, try to get the blood, circulating through there so that the fluid gets better distribution into the fingertips. You want to do the same thing with the legs, make sure those get a nice good working so that the fluid gets down into the toes. Usually I'll stretch them out, try to, loosen everything up. And again, this is all for better distribution. These are just things that I do. This is, I think what most embalmers would agree, that they'll do some stretching and some massaging on the person. So ideally, that one vessel will be all you need, and then the person gets, beautiful distribution, beautiful color, beautiful, nice plumpness to the skin, good texture, all those good things. On the off chance that, that doesn't happen, which is quite often, maybe they'll get it everywhere but, the legs. Then you might have to raise alternate vessels. So for the legs, we'll use the femoral arteries. For the arms, we'll use the axillary. There's a whole bunch of other ones. Those are the main ones that I'll venture to use. I'm not gonna go, looking at those obscure vessels like the popliteal, which is like behind your kneecap or anything like that. That's just a pain in the ass. But yeah, so once you're done injecting arterially, the next thing that you're going to do is treat the cavity, so the organs. What that entails is there is an instrument called a trocar. If I can find a nice photo, I will insert that here. What the trocar is, it's a thick, maybe a little less thick than my pinky finger. It's kind of like a hollow needle. It's about yay long. It has a handle on it, and at the tip it has vents so that the fluids that you're going to be taking out of the abdomen can get suctioned through. So you hook up your aspirator to that, and you aspirate the fluids and gases out of the cavity with the trocar. You insert it above the belly button, above and to the side of the belly button. I know textbooks, I think, say to go to the right or left. It doesn't really matter. It's really just a matter of looking at what you're dealing with and seeing what works best in that situation. I don't really go by, it has to be on this side or it has to be on that side. Whatever works for what I'm doing is what I'm doing. So you take the trocar, you insert it into the abdomen, and the goal is to puncture the organs to withdraw any fluids or gases that are hiding in there. So all of that gets taken out. You aspirate up into this portion of the abdomen first, and then you go down into the lower portion. Everything gets, nice and cleaned out. After that, you need to treat the cavity with cavity fluid. So cavity fluid is also formaldehyde, but it is a higher concentration of formaldehyde, and it is not diluted with water. So it's just straight formaldehyde getting injected into the cavity of the body. So I'll usually do one bottle pointing up, one bottle pointing down, and that is basically treating the cavity. After that, the hole that was made is plugged up with, it's called a trocar button. So it's, I'll put a picture of what that looks like if I can find a nice looking one. And after that is done and everything is, you know, sutured up nice, then I will give the body another washing completely, make sure that everything is clean. And after that, you're pretty much done with the embalming process. After that's all completed, later on you will do the dressing of the body, the casketing of the body, the cosmetology of the body, the hair, all of that good stuff. But that's, in a nutshell, that's it. That's the embalming process. Big difference between embalming and an autopsy is embalming is very minimally invasive. When I'm saying, you know, I'm going to make an incision here and I'm going to make an incision there, the incision is only about that. It's very small. Extremely small. We're not taking anything out. We're taking fluids out of the cavity, out of the organs, but not the actual organs. They get to stay in there. That's fine. Now, on the off chance that you're going to be embalming a person that has had an autopsy, a lot of embalmers think that they're more difficult. I don't think that they're more difficult. I think that they're more involved because there's more things to think about. So pretty much embalming an autopsy case, you'll have to undo all of the sutures that the person that performed the autopsy did. So you have to basically open them back up. The viscera that is placed in the bag that I mentioned earlier, that we will usually take out, put into a receptacle, and we will just put a bottle or two of cavity fluid in the bag, and you kind of let them, for lack of a better term, marinate. Sounds really weird, but that's pretty much what it is. So you let the organs marinate, and vessels that you're going to be using, you should be able to locate them pretty easily because everything's been cut. So you'll see like a stump for each part of the body that you're going to be embalming. So you'll see a stump where you can embalm the head and the face. You'll see stumps where you're going to be injecting for the arms and for the legs. So you're not just using one artery. You're forced to basically use everything, pretty much. But once that's all done, we'll, you know, clean them up. We'll put the viscera bag back into the body cavity, sew everything up nice and tight again, and you know, setting of the features is the same as a standard embalming. So it's pretty much just instead of using the one artery, you're using multiple arteries, and there's a lot going on at once. So, you know, a lot of embalmers would say that embalming an autopsy is more difficult. Again, I don't think it's more difficult. I just think it's more involved. But I do recommend having more than one person do the embalming if possible. Like, if you can get a helper to help you do stuff, it goes a lot faster and it's a lot easier. So there's that. So that's pretty much all of the differences between autopsy and embalming. So as you can see, very different procedures done for completely different reasons. But still, you wouldn't believe how many people come and see me and they'll say, well, I don't want an embalming done because I don't want any of my loved one's organs removed. And then I have to explain to them, no, we don't remove any of the organs. You don't have to worry about that. And, you know, you kind of have to give them a soft explanation of what it is without going into too much detail, because you do want to be respectful towards their grieving. But that's, again, in a nutshell, that's pretty much the difference. Please like, comment, subscribe for more content. I really am enjoying making these videos for you guys. Be sure to follow me on my social medias, my Instagram, which I will link down below, and you can also follow me on TikTok for condensed versions of funeral facts that go up on Fridays as well. And that's all I've got for you today. That's all the facts that I'm going to give to you today on embalming and autopsies. So I will see you guys in my next video. Bye!